Hey there, this is Kristen with a quick content warning before we jump into the episode. We're talking about a face transplant case, which includes mention of attempted suicide. If this is a sensitive topic for you or anyone else listening, please take care. Thanks. This is Health Matters, a podcast from Mayo Clinic where we discuss the latest medical advice, news, and research to help you live a happier and healthier life. My name is Kristen Meinzer. I'm a writer and journalist, and this episode, we're talking about face transplants. Face transplants are a pretty recent development as far as medicine goes. Doctors have only been doing them since 2005. Between then and now, only about 50 face transplants have been done in the entire world. That's fewer face transplants in 20 years than the average number of kidney transplants per day. Why so few? One reason is that a face transplant is a complex undertaking. It requires all the expertise a surgeon can bring to the operating table, but if it goes well, the results are truly life-changing. On this episode of Health Matters, we're talking to two people who are part of a revolutionary moment in Mayo Clinic history. Dr. Samir Mardini, a facial plastic surgeon who performed Mayo Clinic's first ever face transplant, and Andy Sandness, the recipient of that transplant. We're going to hear firsthand their amazing story, which is also told in Mayo Clinic Press's new book, Face in the Mirror. First, we'll get some background on the science of face transplants with Dr. Mardini, and then we'll talk with both Andy and Dr. Mardini about what it was like to go on this journey together. Dr. Mardini, welcome to the show.
Thank you. It's an honor to be here. I appreciate the invitation.
Oh my gosh, it's an honor to talk with you. This is such a fascinating topic, and you are one of the preeminent people in the world, one of the only ones who can really talk about this topic. So first, let's get some general background information on face transplants. For a long time, this was the stuff of science fiction. It is something that you do, but when in medical history did it first become a reality?
So some of the pioneers in face transplants started looking at this in the early 2000s, and by 2005, the first face transplant was done successfully in France. And since that time up to today, there's around 50 face transplants that have been done. Each patient has a different deformity. Each patient has different drives and motivations and functions that are trying to restore. So it's a really incredible honor to be part of this field where patients are getting their lives transformed.
Let's talk about what some of the early barriers to face transplants were. You just said it was only within the last 20 years that face transplants really became a reality. What changed in medicine to start making that possible?
The biggest issue that we deal with in transplant in general is the lifelong immunosuppression. And that is a major hurdle to any patient signing up for a face transplant. They have to understand the risks. The procedure has to be a worthwhile endeavor for them to take on the risks that are involved. And so that's something that's a serious consideration for any transplant, whether it's a heart, a kidney, a lung, or a face. The technical part of the surgery is quite complex. It requires a huge team. It requires a lot of preparation. And over time, this was studied, and the tissue types that are involved in face transplant are different also than solid organs, where skin was always thought as maybe to be more antigenic and maybe there'll be more chances of rejection. But on the other hand, skin is also more visible and you could pick up rejection much earlier. So there's that advantage to it. So I think once the technical parts were overcome and people were starting to see that the face, although it's a life-giving operation, not a life-saving operation like a heart is, for the patients that are dealing with facial deformities, when they walk out every day to the streets and they're stared out by kids and dealing with functions that are missing, to them, that is a life-saving operation. And once that was seen that way and the technical considerations were managed, then the field began.
So it was both the perception of this being an important surgery, but also the technicalities and the specific tissues and so on in the face.
And one of the other things is the ethical issues that are involved. Is the donor's face going to be recognized? Is a recipient going to accept the face? There are a lot of things like that that were looked at and carefully discussed between the surgeons and the ethicists and all the other team members that have contributed over time.
That makes so much sense because it's not the same as a heart transplant in that way. It is something that the whole world is going to see. When do doctors such as yourself consider face transplants as a treatment option versus conventional surgical reconstruction?
There are many patients that are in need of something different than what we have in conventional reconstructions, because we have patients that suffer from injuries to their midface and major parts of their face, their eyelids, their mouth, and they get surgery after surgery with sophisticated techniques. But there are patients that we do operation after the operation and we improve them, but they do not restore the facial function aesthetics that they're looking for. And that's where the desire and the need and the drive was to find the options other than our conventional techniques.
And when did face transplants become part of your practice? How did you get into doing these?
Well, I met Andy early on in my time at Mayo, which was in 2006 when he had his initial injury. And I was fortunate to be the person on call and we got to know each other. He's just an amazing human being. And he was someone who we operated on multiple times, had successful operations, but Andy was still dealing with deformities and functional issues that were impairing his ability to lead a completely normal life. And during that time is when the field of face transplant was born, around 2005, 2006. And so it was something that we were hearing about. We were trying to figure out exactly what patients would benefit from that. And at some point within a 2-3 year period, we were starting to see that maybe someone like Andy is someone we can help with face transplant. So I called him up at some point and said, Andy, come over. Let's talk about different options for reconstruction. And that's when I brought up the fact that the field was beginning. I'm trying to learn about it and find out about it. And he said, Doc, sign me up. And I said, Andy, this is not one of these procedures where we do all the time where you can tell me that you want to sign up and it's just going to happen. I'm learning about it. Our team is learning about it at Mayo. And I need you to learn about it because this is one of those procedures you have to understand in the fullest sense of the word for the team to even consider you for a face transplant. So he began his journey of understanding and learning about face transplant. During the same time, we were trying to do the same. And so at some point we met again and Andy came back fully informed and he met with a team. We have a multidisciplinary team involving a psychiatrist, medical physician, social worker, and other team members. We were at the same time building the program and getting it approved by the Mayo Clinic. And at some point we were ready and he was ready and we moved forward.
And was there any kind of special preparation or training or even possibly mentorship from other face transplant teams as you prepared for Andy's surgery?
So one of the things that we did early on is go around the world and try to learn from other people what they learned and what they learned not to do and what was successful. And we have a lot of great friends around the world that were very generous in sharing their knowledge. We talked about the ethical issues. We talked about the complications. We talked about the technical aspects. When Mayo Clinic approved our program, which was a 3-year to 5-year process, then it became a burden to try to make this a worthwhile endeavor for Andy. We worked hard as a team to understand every aspect of the technical part, the anatomy. We went to the cadaver lab over a 3-year period, about over 50 Saturdays, rehearsing every detail, dwelling over every aspect of the procedure. We incorporated 3D modeling and virtual surgical planning with our team to try to get the cutting guides and all the stuff so that the surgery goes smoothly. And that's how we got prepared for this.
It sounds like you went in with all the preparations anybody would ever dream of in order to do this with care, with compassion, and also with expertise. Speaking of the technical side, when we're talking about this type of surgery and what a face actually is, what parts were you planning to transplant with Andy?
You can pretty much take any part of the face that is missing and procure it from the donor. So in Andy's surgery, he was missing parts of his face that included the bones, upper jaw, lower jaw, the teeth. and everything overlying that, including the nose and nasal bones. So all of that was possible to procure from one donor, and then you can transplant that and not only restore the aesthetics and the harmony in the face, but also the functions that are missing. And when you are able to take all of the structures in one piece, you're able to achieve better function and better aesthetics.
So you mentioned earlier that the technical parts of the surgery are more complex than other types of transplants or procedures. But are there ways in which face transplants are similar to other types of organ transplants?
The similarity is in the immunosuppression that is a standard for all transplants, including kidney and heart and other organs. So we try to use a standard immunosuppression so that we do not run into issues with rejection from trying different medication. The numbers in face transplant are too low to be studying immunosuppression.
And like with other organ transplants, you also need a donor. Can we talk more about who makes the ideal donor?
So the things that we match is gender, age. Age is a choice you have to make as a team. You can consult with your patient and see what they're willing to accept. Skin tone, you don't want to have a skin tone much darker or much lighter. And you match size, the bony structure and the rest of the facial structures. And then you match Epstein-Barr virus, because if you have a mismatch, you can have blood cancers. So those are the things that you match for the most part. You could transplant different genders, but it's not really necessary to take maybe a female to a male as a possibility because you can achieve a good outcome. But that's something that we didn't want to proceed with. And nobody has done that.
And how do you decide if someone is a good candidate to be on the receiving end of a face transplant? For example, you speak very highly of Andy and what a good candidate he was. What specifically made him a good candidate?
It's not perfectly defined. There's the anatomic defect. It has to be something where if you map a path of conventional reconstructions and you compare it to what you could achieve with a face transplant, you can see if your map of conventional reconstructions could yield good functional aesthetic outcomes. You definitely do not want to do a face transplant if you can avoid it. If you think you can achieve similar outcomes with conventional techniques, because you're committing the patient to lifelong immunosuppression. That's the anatomic part. Someone who's medically healthy, they have to be able to process and understand what they're getting themselves into. They have to be resilient, because this operation could go very smooth, which we're very blessed that in Andy's case, it was as smooth as you can possibly imagine. But it can also yield complications and major disasters that if the patient doesn't have resilience, they wouldn't be able to deal with it. So Andy came to us extremely fit, extremely healthy mentally and physically, just ready to take on this journey. And so he came, he did his part, and we did our part. And we're extremely blessed, and we do not take for granted the fact that we're sitting here together. Andy's doing great, just living a normal life.
Face transplants are a big deal. Currently, doctors only consider them if a patient's needs go beyond traditional surgical reconstruction, because a face transplant is a long, complex process that comes with its own set of risks. Like many other organ transplants, it requires lifelong immunosuppression. It also requires a donor with similar features and a recipient who is physically and mentally strong and resilient. Speaking of recipients, that brings us to Dr. Mardini's patient, Andy Sandness. As Dr. Mardini told us, he spent years getting the face transplant program approved and many, many Saturdays over multiple years practicing the surgery so he could get it just right when it mattered. But Dr. Mardini was only half of the equation. Let's meet Andy. Andy, let's get you into this conversation now. Can you tell us a little bit about yourself?
So my name's Andy. I'm from Wyoming originally. I moved to Minnesota in 2020, right during COVID. I work for a solar company now. I just install solar panels. My wife works. We just built a new house 2 years ago, and we're still working on it. We have 2 kids. They're 4 and 2, so they keep me on my heels. And actually, me and my son go for his first real haircut on Saturday to a barber shop. So that's why I look like a scrub.
Ah, a daddy and me haircut day.
Yeah, it's going to be a blast. He's really excited. So
Oh, that's so great. And can you tell us how your journey to this face transplant surgery with Mayo Clinic first began?
So it all started in 2006. I tried to commit suicide unsuccessfully, thankfully. I was supposed to go to a Broncos game the next day. Me and my buddy were hanging out the night before and I just snapped and ended up in the hospital, and was fortunate enough that Dr. Mardini was on call that day. From that first moment, we met, and he went out into the hall with my mom, and I think he promised her that he would take care of me. From then on, I just felt comfortable around him. We became good friends. He's like an older brother to me. Through everything there, I think I had like 14 surgeries in the beginning. I don't know the exact number, I can't say, but it was a lot. Went in there in December of 2006 and left in April of 2007, and basically was in for surgery every week or every other week. I got released back to home life, and you get so used to being in a hospital that it's different when you get back home, and you're coming from somebody that just tried to commit suicide, and you're embarrassed, and you have to go back to your hometown and deal with everything now, right? I thought I had hit rock bottom when I tried to commit suicide. And then I realized when I got home that now this is really rock bottom. And, the only way to do that is just take it day by day. I couldn't sit still. I went and got a job. And that's the best thing for me. I love to work, and that's how I deal with all my issues.
So you're working hard, you've met Dr. Mardini, and you've gone through a number of surgeries with him. And then the face transplant idea gets proposed to you. And when you were first offered this, only about 24 of these surgeries had been done at the time. What was going through your mind as all of this was being presented to you?
So I'll never forget the call. It was like 507. I know that area code, and it was Dr. Mardini, and I'm like super excited. Okay, let's do it. When do I get to do the face transplant? He's like, whoa, hold on. It was May of 2012, and I didn't get the call till January of 2016 that I was actually going to get the face transplant. Like, I had been accepted. So through those almost 4 years, it was just me being a candidate, and I just had to tell everybody to calm their expectations, because this is not a thing yet, right? Anything could have happened that could have changed this for me. All it would have taken was, one thing that I had said to the psychiatrist or the psychologist or anybody, and they would have said no, right? So you have to be open and honest and tell them everything. When I went in there with all my friends and family, Larry, Twyla, my mom, my dad, we had all these people up there meeting, and I said, just be honest with them. Tell them the truth. Like, we have to have it all on the table.
I mean, I can already hear from your enthusiasm and eagerness to learn and your curiosity why Dr. Mardini and his team thought that you would be such a good candidate for this. And once this possibility became a reality, what were your personal goals for the face transplant?
I'd have written out a list before, right? Like, make a list of stuff that you can't do and make a list of goals that you want. And so, there was a lot there. I had a prosthetic nose. We couldn't afford to go and get a new prosthetic nose every year. You're supposed to get one probably every year. You're not supposed to work outside, which I do. It would fade. You're not supposed to get oil on it. Well, I worked in the oil field, and got it dirty. So I would take it home and scrub it every night. And then I didn't care so much about it at work, but like if I ever went out with my social life, then I had to paint my nose. So that was one of the biggest things that I wanted to get rid of, was that nose. I wasn't eating properly. I only had one tooth at the time, so I couldn't chew steak. I still ate steak, but I just had to, manipulate it with my tongue and cut it into super small pieces. No, I didn't have function. I dripped and drooled all the time, and it was just hard. And then I wanted to be able to swim. I had a nephew at the time. We were roughhoused, and then my nose fell off, And it's like, that's scary for those guys. I don't want them to see that. And then also, now you have a deformed face. Well, you're not very attractive, and it's going to be hard to find somebody that loves you for who you are, You have a ton of depression that came with looking like that because everywhere you go, everybody's staring. You're the elephant in the room. There's no doubt.
Mhm. Yeah, it sounds like there were a lot of potential improvements to be excited about. But was there anything that worried you?
The biggest thing that scared me was the immunosuppression. I was 100% healthy. I never took Tylenol. I never took medicine. I didn't take anything. And I didn't feel like I needed to. And so that was really scary for me. The first time I started taking it, you don't feel good. Even times now, there's times when I take it and it gives you a bellyache. You don't feel good. To get the shakes, you got to go sit down and eat a snack bar or something, and take care of yourself.
And do you remember the moment you found out the surgery was actually going to happen? What kinds of emotions were you experiencing?
Dr. Mardini had called that night before. I just got chills when I saw his number. Like the hair just stood up. I got goosebumps and I was like, oh man, what is going on? This is never the time that he calls. And then, he says, hey, we think we found the candidate for you. And that's all that he could say. But that was it. And then I went home that night, right? So it's like, oh yeah, we probably have a candidate. Well, good luck sleeping. I'm super excited. But then at the same time, that somebody is losing their life, right? Somebody's dying for you to get this surgery. And so it was really conflicting feelings that night. I obviously called all my friends and family that knew about the surgery. And I'll never forget when I had to call my brother and tell him, hey man, like, this is it. Like, after I felt really confident in this surgery, that was the first time that I had cried, was tell my brother, like, hey man, something could happen to me, dude.
Oh, wow, what an emotional roller coaster. And what were those first few weeks like after the surgery?
So you got everybody coming in, all the nurses, everybody's in there saying, hey man, you look great, you look awesome. And then I remember Dr. Mardini's like, have you touched your face yet? I said, well, no. And he's like, well, you can. Don't be scared to. And I'm like, oh man, I didn't know I could do that,
Dr. Mardini and Andy, I would love to hear from both of you about what it was like when Andy saw his new face in the mirror for the first time.
We all go into medicine to see transformations. And with Andy, it's just as dramatic as you can get. We waited for a psychiatrist to talk to Andy for a few weeks. We waited for the anesthesia to wear off. We waited for him to be feeling good. And we just made the unveiling into like a special, meaningful moment, of course, with Andy's permission. And we had a lot of the closest people that had taken care of him in the room, including his family. And when he looked at himself in the mirror, he didn't have facial expression at the time because the nerves were not working yet. He couldn't smile. He couldn't show emotions. He looked at himself for a while and kind of stared and turned around. And I asked him how he was feeling or what he thought. And he wrote on a piece of paper because he still had the trach in. He said, far exceeded my expectations. All along, all we wanted was him to be satisfied and happy. And that moment just said it all.
Oh, that is fantastic. And Andy, what was going through your mind?
Oh, it was amazing. The room's filled with people, right? So I tend to shy away from people, and all eyes are on you. And I was just blown away. I mean, you're still just super swollen, but you know that you had a great outcome.
Andy's face transplant was years in the making. From his initial injury to becoming a candidate to being vetted, it took more than 3 years. And on top of all that, they had to wait for the right donor to emerge. Finding that donor and the generosity of that donor's family set everything Andy and Dr. Mardini had prepared into motion. And the surgery was a huge success. But that's not where the story ends. Let's hear more about Andy's life with his new face and what this means for Dr. Mardini and Mayo Clinic moving forward. So, Dr. Mardini, how do you actually measure the success of a face transplant surgery?
You have multiple layers and levels of success. The patient getting off the table successfully. This could be an operation that just he doesn't survive the operation. That's a possibility. Survival of the face, the blood supply not clotting and the face taking. And then you have the take of the graft not rejecting. You have the ability to feel the ability to function and have facial expression. You have the ability to eat and swallow and breathe. And you don't want to harm the functions that he had already. He was able to close his eyelids before he was able to raise his eyebrows. Those are nerves that we could have damaged during the operation. And that's another success. I think the biggest success is achieving the goals of the patient. If you have a patient that you've done stuff for and they're not happy, you haven't achieved your goal. And Andy being happy and satisfied and leading a normal life is really our biggest measure of success. And then lifelong, how he's doing and how he's incorporating. One of the things was, will he accept the face? And we were all so incredibly touched when he told us the story of, he said, for 10 years that I had the facial injury, when I saw myself in my dream, it was my face before the injury. And last night I had the face that I have today in my dreams.
That's such a beautiful, perfect outcome, and something that you can't just measure on a chart by checking a box. Now, Andy, going off of Dr. Mardini's answer, what parts of your surgery and recovery do you consider successful?
To be able to get back to living a normal life. I was able to get married. I have 2 kids. I can go swimming. I can eat basically anything I want besides grapefruit. And, I can't go to salad bars and stuff like that. But for the most part, we did achieve my goals. I have a functioning face. When I smile, I can smile. And then, the aesthetics part of it is a big part of it too, because when I go into the store, people are like, oh, you got in a car wreck. And I'm like, well, no, actually it's a lot bigger than that. And then just leave it at that. And it was just great. The team, they worked so hard. It's like, you guys did your part. Now it's time for me to do my part and just make sure that I could be the best patient ever, take my medicines on time, and do everything that I was supposed to do.
And when did you start feeling like the nerves were connecting in your face and you were able to do everything you wanted to with your face again?
So very early on, Dr. Mardini was like touching my face right on my jawbone here. And I'm like, I can feel that. The nerve right then and there just started zinging, And he's like, no, it's too early. Like, there is no way. And I'm like, okay, well, whatever, maybe I'm just feeling something. But no, it's taken years. The nerves are still growing right now. I don't have it perfectly all the way to the tip of my nose, but it's starting to come down to the tip of the nose now, So it's a very, very long process for nerves to grow.
Wow. It's amazing all the things that your face is doing now. Just eating steak, having conversations, and all of that when initially none of that was there before. It's incredible. And is there a moment when you felt like, oh, this really did what I wanted it to do?
I'll never forget going up to the Charlton building to meet with everybody, and I hop in the elevator, and there's a little kid in there. And normally the kids would just clutch their mom, and hide behind their mom. And the little boy just looked at me and smiled, and I just waved at him. And that's when I knew that it was successful, that we had gotten most everything that we wanted.
Oh, that's great. Dr. Mardini, I'm curious what Andy's success means for the future of face transplants at Mayo Clinic. Will this be accessible to more and more people going forward?
We have a incredible multidisciplinary team here at Mayo Clinic, both on the facial reconstruction side and on the face transplant side, where we are assessing patients together and really thoughtfully trying to figure out which patients would benefit for this. For example, in Andy's case, his success is huge for his life. It's huge for the team that's doing the transplant, and it's huge for the field of face transplant, because every success is a success for the entire field of face transplant, and every failure is the failure for the entire field. We've transplanted another patient last year who's doing incredibly well, thank God. And we're constantly evaluating patients and trying to counsel them on what's best for them. I think Andy felt that and saw that. I felt that and saw it. It's just tremendous to be part of it.
Are there things you learned from working with Andy that go beyond face transplants?
I learned a lot about the teamwork. I learned a lot about the way Mayo Clinic works. Building a team, building a program. I saw how other people around the institution from every part, systems engineering to media support, to the cadaver lab, to every aspect, nursing and others are my colleagues in surgery who were obviously hugely integral. To see them all work together to benefit a patient was tremendous. And the last but not least is I saw the generosity of the donor and the donor family and what they were willing to give up as a gift. So in their hardest moments of grief and sorrow and sadness, someone's coming to them and saying, there's a patient at Mayo Clinic that could benefit from a face transplant. Would you be willing to give that gift of organ donation of the face of your loved one to someone that you don't know? And the fact that someone has the courage to do that is truly incredible.
That's beautiful. Andy, is there any advice you would give to other folks in similar situations or any other reflections on your experience you'd like to share?
It's not going to solve all your problems. You're still going to come up with other issues, and then you have to deal with these other issues and be strong and figure out ways to do it, right? And, it's all about communication with the team and making sure that they know what you're going through. There's a lot riding on your shoulders, from the hospital standpoint. Everybody's looking at you. You're under a microscope. Mm-hmm. And everybody wants to make sure that you're the right candidate, you're the right person, so it's not for everybody. One thing I do want to say, is none of this is possible without the donor's family. And like Dr. Mardini said, they're making the hardest decision that they could ever make in a moment. So I'm just very thankful for the family, and I just couldn't imagine going through that.
Yeah, that sense of gratitude in this new life is not possible without them. I feel so moved by all of this, and I learned a lot today, and I also just feel like I got a lot of something deeply emotional out of this conversation too. So I really appreciate it. Thank you.
Yeah, thank you.
Thank you so much.
You can measure the success of a face transplant by the health and functionality of the recipient. But perhaps some of the biggest successes are things you can't measure at all, like playing with your kids, enjoying a good steak, and being able to do the little things most of us take for granted. And while Andy's operation was a huge success in and of itself, his story is also a success for the entire field of face transplants, allowing doctors to learn, grow in their practice, and provide life-changing care for more and more people. If you want an even more in-depth version of Andy and Dr. Mardini's story, check out Mayo Clinic Press's new book, Face in the Mirror, A Surgeon, a Patient, and the Remarkable Story of the First Face Transplant at Mayo Clinic. We'll provide a link in the show notes. Okay, that's all for this episode, but if you've got a question, a topic suggestion, or a follow-up question about this episode, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. And stay tuned for the next episode of Health Matters, Mental Health and Primary Care.
And so I walked in and I shared my genuine surprise with the patient. His response was, "It surprised me too. I didn't plan to tell you today."
For more Health Matters episodes and resources, head to mayoclinic.org/Health Matters. And if you found this show helpful, please subscribe and make sure to rate and review us on your podcast app. It really helps others to find the show. Thanks for listening, and until next time, take care and stay healthy.